Studies have shown that up to 84% of adults will suffer from low back pain at some point in their life. With odds like that, it's not a matter of if, but rather when we will most likely experience a bout of low back pain. Now, low back pain comes in many different forms. It can be acute or chronic, meaning it can happen quickly with a very specific incident, or it may progressively and slowly come about without a specific mechanism or even injury. It can be degenerative in nature, where over time and from living active lifestyles, we put routine stresses on the structures of our lower back. These stresses slowly wear down the cartilage, we see bony adaptations and effects to the overall structures of the low back region. There are also traumatic injuries, such as fractures or herniated disc, due to high impact or force or other excessive positions and demands that we place on the back. Low back pain can be complex, and there are a variety of injuries above and beyond just the few that we've mentioned here. Today we're going to focus on low back strains. We'll cover the anatomy, symptoms, common causes, and typical treatment. When we get into the treatment, we'll break this down into mobility, core stability, and general strength training considerations. Low back strains, or you may hear it communicated as a lumbar strain, is when we injure the muscles of the lower back. Strains and sprains are sometimes inadvertently used in the wrong context. A sprain is an injury to a ligament, whereas a strain refers to an injured muscle. And these are graded as 1, 2, or 3, with 3 being the most severe. Most lumbar strains will be grade 1 or 2, and these are often treated conservatively through activity modification, medications at the discretion of a physician or qualified health provider, and physical therapy. The muscles most commonly strained in the low back are going to be the erector spinae muscles and the quadratus lumborum. The erector spinae muscles are actually 3 different groups of muscles: the spinalis, longissimus, and iliocostalis muscles. These muscles run the length of the low back, along each side of the vertebral column. Their main function is to extend the spine. Extension is the act of leaning back or bending backwards. These are the same muscles that are active and necessary to help us just stand upright, which is why it can be so challenging to stand tall after you injure your low back. The quadratus lumborum is a muscle that lies just a little bit deeper in our body. It runs from our iliac crest, or the top part of your pelvis, and inserts on the transverse process, or the side of our lumbar vertebrae. This muscle is involved not only with the extension of the low back, but also with bending side to side and influencing how well we can rotate, twist, and turn. Understanding the anatomy and the actions of these muscles, it'll better help to appreciate the exercises that we're selecting to stretch and strengthen them later on. Low back pain from a muscle strain can present in a variety of different ways. Many will report a stiffness that's restricting their range of motion. This stiffness can be due to a dull, aching sensation that creates a tendency to avoid movement in fear of creating more pain. It may also feel like a stronger sensation, or even like the muscle is spasming and physically restricting you from being able to move. Due to the discomfort, you'll most likely notice yourself altering your posture and finding different ways to stand, sit, walk, and even move throughout the day. These modifications may reduce your low back pain, but could result in aches and pains elsewhere due to the unusual stress you're placing on the hips, upper back, and neck. Another interesting thing about muscular pain is that it can even radiate or refer to other areas of the body. These muscles commonly refer towards the SI joint, the hips, or the gluteal region. The glute muscles are located where your back pockets and side pockets would be in a pair of pants, just to help reference that. The frequency and severity of these symptoms will vary from person to person and often coincide with the severity of the injury. A physical therapy evaluation will be catered to each and every person's own unique situation. The purpose of the evaluation is to establish a baseline for what an individual can perform and tolerate. These findings will allow the therapist to relay where you stand in relation to what normal ranges are, track your progress, and then best develop a plan of care for you. The secret to optimizing a plan of care is knowing what you're currently capable of doing, what you need to work towards as an ending point, and determining what are the biggest limiting factors that are preventing you from doing all of that currently. The findings from the evaluation will help answer all of these questions. Your range of motion will be assessed both locally at the low back, but also to the surrounding joints and muscle groups. Being able to reach for your toes, move side to side, lean backwards, and rotate each direction in various positions, all of that is important in assessing overall lumbar mobility. Checking hamstring, hip, quad mobility, even shoulder mobility is going to be important as well, because all of these different body parts, they're going to influence lumbar motion through an either direct attachment to the lumbar spine or the pelvis. If we're restricted in any of these areas, it can create unnecessary stress and strain or just restricted movement patterns. Strength and core stability will also be assessed. Exercises that focus on the front and side areas of your core, as well as the low back muscles themselves, will all be tested during the eval. They'll be assessed in static and dynamic positions, as the low back needs to demonstrate the ability to be strong and stable with a variety of positions and movements, whether we're bracing or moving fluidly. Now, don't be surprised if your PT also assesses general measures of total body strength and conditioning, just to get an idea of what your current functional status is and what areas of physical fitness can be enhanced early on and both in later stages of rehab as well. The individualized treatment plans will be dependent upon the findings from the initial evaluation. However, most plans are going to all include some component of mobility, core stability, and strength training considerations. Mobility will often focus on restoring flexion and extension, side bending, and rotational motions of the low back. Flexion and extension, that's essentially just the ability to arch and round the back. Common exercises include cat-cow, prone press-ups, and other variations of these two foundational positions. Working on this in various positions will help to improve tolerance to sitting, standing, and activities of daily living. You may also practice various positions of distraction or providing gentle traction to the area. This often provides a sense of relief through decompression, and it also just provides a very unique stretch to the muscles that's hard to mimic in any other way. Mobility is going to focus on isolating one motion or one position to start off, and as you gain confidence and further competence to that area, we'll make it a little bit more complex. So as you progress through these mobility drills, you'll start to notice that you'll begin to combine motions and multiple movements and body parts together as one. Some exercises may be more static in nature. This is where you're just holding for a given amount of time, say maybe 20, 30 seconds, or even longer than that. Now, you'll also perform dynamic tasks, and this is when you're going to be working within a comfortable range, kind of teasing the border of what's comfortable and what's a little bit sore, and you'll do this continuously for about 5 to 10 repetitions. Rotational and side bending motions will happen lying on the ground, in quadruped or on all fours, or half kneeling positions, and even progress to standing. This may be influenced by how well you can tolerate a position, or simply if you have any other orthopedic issues that may just limit your ability to do one more than the other. In addition to focusing on the lower back, you're also going to allocate some time to the hip and lower body in general. The quadriceps, hip flexors, hamstrings, glutes, adductors, they're all going to play a role in how well we move and how much work we're asking the low back to do with daily, leisure, and work demands. Now, don't be surprised to find yourself performing variations of quadricep stretching, either in standing or kneeling positions. My favorite is the half kneeling quad stretch because it can easily be performed at home simply with a couch or a chair. Now, there's a variety of ways that you can stretch the glutes or the hip rotators or some of the muscles located on the back and side of the hip, but a pigeon pose is one of my favorites. And this is just because of the overall versatility with it. It can be done on the ground, at a table, or even in a bed very, very easily. You can pick and choose which version based on your environment and which one feels the most comfortable and effective for you. As far as hamstring stretching goes, you may find yourself using a door frame for a passive and relaxing stretch in the early stages. However, later on in the rehab, it's common to transition towards more dynamic standing variations, and these often look like just a warm-up for a good exercise routine. The options for mobility are nearly endless, which is nice because it provides multiple avenues for relief, but it also provides a way just to give variety throughout your programming during your PT sessions or as part of a long-standing home exercise program. In addition to mobility work, you'll also find yourself doing some targeted core stability. These are often the drills that a lot of people associate with rehab and physical therapy. These activities will make up a portion of your rehab experience, but keep in mind these are not all-encompassing, and they just serve as an adjunct to a well-balanced plan of care. In this section, it's common to find isometric drills where you're asked to hold a position with resistance coming from different angles or positions. Planks, including both front and side planks, are often a staple in many rehab programs. Front planks are going to work on the ability of the anterior core, or the front of our stomach, to provide enough strength to maintain a neutral spine position and not allow the back to arch during the exercise. These may be modified by the height of the object that you use, or attempting them from maybe your knees as opposed to your feet. Side planks focus on the muscles of the side of our core. These are the ones that help with rotation and bending side to side. Much like a front plank, they're going to focus on getting into a position and not letting gravity and the weight of our own body move us out of that position. Starting on your knees as opposed to your feet is common, and sometimes even adding in additional leg motions may be appropriate to increase the challenge from your knees before progressing out to the feet. Now, direct low back strengthening through back extensions, Supermans, or other common exercises may be warranted if these muscles have proven to be weak with testing from our evaluation. However, sometimes in the early stages, they may be too irritable to implement. So a common way to work around this is that we'll often try to attack this motion through hinging at the hips. And we're going to cover this in the next section when we get into different strength training considerations. You may also hear the term anti-rotation get used in this phase of rehab. These follow the same idea as the planks that we talked about, where you're getting into a position and you're not allowing gravity or external resistance to rotate or twist our body. Bird dogs, dead bugs, Palloff presses, these are all common exercises used to train these muscles, and they all provide varying levels of resistance and complexity. The dead bugs or bird dogs, they'll focus on teaching you to utilize upper and lower extremity motions without compromising core stability and position. The Palloff press will allow you to add as much resistance as desired and experiment with different standing and functional positions. Now, different crunches, sit-ups, or other traditional abdominal exercises may be introduced during this phase as well. And typically, as a PT, we want to focus on one of two things. We either want to build your strength and endurance with these drills, or we're focusing on optimizing the movement itself and using these drills to teach you the best way to move at a high level of performance with reduced risk for injury. An often overlooked aspect of physical therapy is general strength training considerations and finding ways to get individuals moving early in their programming and in a safe and confident way. A lot of research shows that just consistent daily physical activity is very beneficial for individuals rehabbing from a low back injury, and it doesn't even need to be specific low back rehab. Simply getting back into a walking routine or a general total body exercise routine that is scaled back to their tolerance and ability is advised in the early phases. This is part of the reason why a portion of the evaluation should be focused on this, so that we can figure out what is appropriate and what's reasonable to start with. Mentally, it is huge for a patient to maintain some sort of semblance to their usual daily routine to allow them to maintain consistency in other areas of their life as well, such as work, sleeping, diet, and just stress management in general. The easiest way to think about strength training and its relevance to low back pain is that even when the legs and arms are doing the work in these exercises, the low back muscles are typically involved in just stabilizing the core. It's essentially functioning in an isometric environment just as it does with planks and other activities that we already talked about in the more core stability rehab focused section of your programming. I often find myself as a PT utilizing total body strength training as a way to sneak in core training early on with patients because they tend to be less apprehensive with this, and it also gets them feeling active again at earlier phase of their rehab. Everybody likes to get a nice sweat going to feel like they accomplished something. Common movements that we focus on are squatting in various positions, hinging, pushing, pulling, and carrying. These are all movements that they'll encounter during their day and also just provide them with feedback as to what activities are safe to do and which ones they may not be quite ready for yet that they're going to encounter with their work and leisure demands. When programming in this type of work, I tend to take a pretty conservative approach early on, and I like to start with low intensity, lower volume, and even modifying the range of motion as needed. Keep in mind, consistency in daily activity is key. So having one good workout at the expense of being sore for the next 3 days isn't really worth it. Start slow, start small, and if it's too easy, just make it more challenging the next day. It's better to think that you could have done more than wishing that you would have done less. Hopefully this video cleared up some ideas you may have had regarding low back pain and the overall role that physical therapy plays. It's not uncommon to experience low back pain at some point in your life. It is uncommon, however, to think that there is nothing that can be done about it. If you enjoyed this video, stay tuned for the next one coming out covering how to treat a stiff neck.